Hi, this is Dr. Vidyashankar. I am consultant nephrologist at Aster CMI Hospital, Bangalore. So, we are going to discuss something on the kidney health, which is very important and which is the utmost priority. And I'm going to discuss a few of the common conditions which can affect the kidney and what all the precautions, how to take care of your kidney for the better health. So, some of the topics which we are going to discuss today will be highlighted. So the most important and a very common condition which affect the kidney, you all know, is the diabetes. So diabetic related kidney is one which is we have to give priority, and I'm going to just tell about how the diabetes affect the kidney and how to take care of our kidney when you are suffering from a long-standing diabetes. So diabetes is becoming more common in Asian and South Asian population, and if you look at the recent data, almost 1 in 5 are suffering from diabetes, and especially we are seeing diabetes in the younger age group. So their survival is also better. So during their course, so after 15-20 years, they are getting affected with the kidney related issues if they don't take care of the diabetes very well. So it's very important to look at how the diabetes affects the kidney and how to recognize the diabetes, is it affecting kidney. So the diabetes, is a silent killer, and recognizing diabetes itself can be done only with a routine test. Similarly, when the kidneys also, when they get affected, they become symptomatic at a very late stage. So it's very important to know at what stage of diabetes they can get the kidney problem and then how to recognize it. So there are two types of diabetes. We all know that there is a type 1 diabetes, which is it happens in children, and type 2 diabetes in adults. So we are going to first look at the type 2 diabetes, which is more common and which affects our population, and that's going to have a lot of economic burden on our society. So after we diagnose them as a diabetes, so usually for first 5 years they will not have any major issue which affects the kidney because they have good glucose tolerance reserve and they'll be well managed with the medicines. But later on, if they don't control their diabetes well, then the kidneys get affected, and it will get affected in the first. They will have the proteinuria, that is, protein start leaking in the urine. Usually patients presents with swelling of the feet, and later on they start developing the blood pressures will go uncontrolled. Then they start developing all the features which are for the chronic kidney disease. So whenever the patients are diagnosed with diabetes, they should always get the kidney function test done. It's very important, because sometimes the diabetes will be there existing for 5 years, 6 years, but they will not have any symptoms. They will not be taking any medicines. So there will be delay in diagnosis of diabetes itself. So once they are diagnosed with diabetes, so they should first get a kidney function test. It's a very simple test. We look at something called creatinine, which will indicator of the kidney function. Then second important test is urine routine examination. So in urine routine examination, we look for some proteins. If there is any proteins in the urine, that means there are filters which are affected, probably because of diabetes or maybe some other reason. These two tests will rule out almost more than 90% of the kidney related diseases affected by diabetes. So whenever they are diagnosed with diabetes, first they have to do the test, that is the urine routine test and the kidney function test, and then if everything is normal, then the strict control of diabetes is very important. And if they control their diabetes very well, then annually every year they have to get the kidney function test done, and even if there is slightest variation of any reports in the creatinine or urine test, they should consult a nephrologist or kidney specialist. So Aster CMI Hospital is well equipped with all the tests which can be done as a screening and even advanced test, and we are available on all the days of week. If any advice required, please consult us in Aster CMI Hospital, Bangalore.